Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share for more. Peptic ulcer disease means painful sores develop. These sores aren't just a minor irritation, they represent a breakdown in your body's natural defenses. They can cause significant discomfort, and if left untreated, can lead to more serious health issues. On the lining of your stomach, or the upper part of your small intestine, the duodenum. The duodenum is the first section of your small intestine, playing a crucial role in digestion. Ulcers in these areas can disrupt the normal digestive process. Imagine a canker sore, but inside your gut, exposed to harsh stomach acid. This acid, while essential for breaking down food, can severely irritate and damage the unprotected tissue of an ulcer. Normally, a protective mucus layer shields your stomach, acting as a barrier against the corrosive effects of stomach acid. This layer is constantly being produced and replenished to maintain its protective function. But when it's weakened, acid damages the tissue, creating an ulcer. This weakening can be due to various factors, such as bacterial infection or prolonged use of certain medications. Ulcers are classified by location: gastric ulcers in the stomach. These can cause pain that worsens with eating, duodenal ulcers in the small intestine. The pain from these ulcers might actually improve temporarily after eating, only to return a few hours later. The real issue is an imbalance. Protective factors like mucus lose out to aggressive ones like acid and pepsin. Pepsin is an enzyme that helps break down proteins, but it can also contribute to ulcer formation when the protective mucus is compromised. This isn't just heartburn, it's a wound in a sensitive area that needs real treatment. It requires a proper diagnosis and a tailored treatment plan to heal effectively and prevent recurrence. Ignoring symptoms can lead to serious complications. These complications can include bleeding, perforation, and obstruction, all of which require immediate medical attention. Millions are affected worldwide, highlighting the importance of understanding and addressing this common condition. But understanding what an ulcer is helps you seek the right care. Early diagnosis and appropriate treatment can significantly improve outcomes and prevent long-term complications. Recognizing the difference between an ulcer and simple indigestion is the first step to healing. It empowers you to take control of your health and seek the necessary medical advice. Our stomachs are remarkably resilient, but they're not invincible. So, what exactly breaks down your stomach's defenses, leaving it vulnerable to those painful ulcers? Let's delve into the primary culprits behind this common digestive issue. The two main causes, the most frequent offenders, when it comes to ulcer development: Helicobacter pylori bacteria, often simply called H. pylori, and long-term NSAID use, which includes common pain relievers you might find in your medicine cabinet. H. pylori is a common bacterium affecting a significant portion of the world's population that can inflame and damage the stomach lining over time, leading to the formation of ulcers and other related complications. NSAIDs, like ibuprofen and naproxen, common over-the-counter pain relievers, block enzymes that help protect your stomach's delicate lining, making it vulnerable to the corrosive effects of stomach acid. Smoking and heavy alcohol use, while not direct causes, also significantly increase your risk of developing ulcers and can dramatically slow down the healing process if an ulcer is already present. Stress and spicy foods don't actually cause ulcers, despite what you might have heard, but they can certainly worsen existing symptoms and amplify discomfort. Rarely, underlying medical conditions like Zollinger-Ellison syndrome, a very uncommon disorder which causes excess acid production or severe illness requiring hospitalization, can sometimes trigger the development of ulcers. For most people struggling with ulcers, though, the main suspects that doctors will investigate are H. pylori infection and the prolonged use of NSAIDs. Identifying the specific underlying cause is absolutely crucial for determining the most effective course of treatment. And of course, managing modifiable risk factors, like NSAID use and smoking, can significantly help prevent ulcers from forming in the first place. The classic sign of a peptic ulcer is burning stomach pain, often between your navel and breastbone. Duodenal ulcer pain may improve after eating, while gastric ulcer pain can worsen with food. Other symptoms: bloating, nausea, heartburn, and intolerance to fatty foods. Watch for red flags: vomiting blood, black stools, sudden severe pain, or unexplained weight loss. These need urgent care. Some people, especially older adults or those on NSAIDs, may have few or no symptoms until complications arise. Persistent digestive discomfort shouldn't be ignored. Detailed symptom descriptions help your doctor decide if further testing is needed. The journey to diagnosing a peptic ulcer often begins with a comprehensive review of your medical history. We'll discuss your symptoms in detail, exploring when they started, what makes them better or worse, and any patterns you've noticed. This initial consultation is a crucial first step. But while your history and symptoms provide valuable clues, confirmation requires specific testing to pinpoint the cause and severity of the ulcer. One of the most common culprits behind peptic ulcers is the bacterium H. pylori. We often test for its presence using a breath test, a stool sample analysis, or in some instances, a blood test. If H. pylori is indeed found to be the cause, treating it with antibiotics and acid-reducing medications becomes key to not only healing the existing ulcer, but also preventing its recurrence in the future. However, the gold standard for definitively diagnosing a peptic ulcer and assessing its characteristics is an upper endoscopy, a procedure where a thin, flexible tube with a camera attached is gently guided down your esophagus, allowing us to directly visualize the ulcer within your stomach or duodenum. During the endoscopy, we can also take small tissue samples, known as biopsies. These biopsies are then sent to a pathology lab, where they can be checked for the presence of H. pylori, and importantly, to rule out the possibility of stomach cancer, a crucial step, especially when dealing with gastric ulcers. Endoscopy is usually performed with sedation to ensure your comfort throughout the procedure. The detailed images and biopsy results obtained during the endoscopy give us a clear and comprehensive picture, which is essential for effective treatment planning. All of these tests and procedures work together to guide us in developing the right therapy, tailored specifically for your individual case and the underlying cause of your ulcer. Achieving an accurate diagnosis is absolutely essential for ensuring effective healing and preventing future complications. Selecting the right treatment approach hinges on knowing exactly what's causing your ulcer, allowing us to target the root of the problem and promote optimal healing. Treatment aims to heal the ulcer and prevent it from coming back. If H. pylori is the cause, you'll need antibiotics plus acid-reducing medication. Finish the full course, even if you feel better. For NSAID-related ulcers, stopping the drug and using proton pump inhibitors or H2 blockers helps the tissue heal. Lifestyle changes matter. Quit smoking, limit alcohol, and avoid foods that worsen symptoms. Good hygiene helps prevent H. pylori. Use NSAIDs only when necessary and at the lowest dose. If you need long-term NSAIDs, ask your doctor about protective strategies. Prevention and early treatment are your best defense against complications. Take symptoms seriously and work with your doctor for a full recovery. UMCC, your ultimate medical consultant connectors.